during my experience in general pediatric to search for prevention of these terrible diseases which can affect our previously healthy children. So as everybody knows that autoimmune diseases are mostly chronic illnesses, and sometimes it can be severe and destructive. So we need to first diagnose what is the type of the autoimmune disease, and then to search for a treatment. But before that, what about starting with prevention? Most of these diseases are, the cause is not known, and it's affecting mostly the younger people and middle-aged. It was estimated with a percentage of 3% to happen in United States with a female to male ratio 3:1. So it is more affecting females. 30% of the cause is genetic based, but the other 70% is related to environmental factors. We have factors which we can control, hopefully, and the other factors, which is like by genetics, of course, we cannot control that. But at least to have an early detection of the disease before it causes a sickness for the person. There is, sometimes it was shown that it is related to races. For example, African Americans, they were found to have more chance to have lupus and scleroderma, while Caucasians, they were found to have more multiple sclerosis. Presence of one of the autoimmune diseases will give higher chance to have occurrence of another autoimmune disease for the same person. Like, for example, kids with type 1 diabetes, they appear to have more chance to develop, on top of that, celiac disease or Addison's disease. So rather than disease-specific genes for individual autoimmune disorders, there may be autoimmunity genes. And it was found in early studies that autoimmune disorders may result from multiple interactions of genes and environmental factors. So, as we said, 30% genetic cause and 70% environmental factors, which includes, on the top of the list, dietary components, second, toxic chemicals, third, gut dysbiosis, and the fourth is infections. All these factors have impact on the body delicate immune recognition system. This figure shows you that presence of the autoimmune disease can be secondary to the interaction of all these three or four factors. So what is our role when we deal with a patient or to solve the problem of autoimmunity? What we can do? So we have these challenges. We need to recognize the specific genetic pattern. Then we need to zero in environmental factors. and coming up with ways to intervene before the disease begins, along with creating public screening programs. So in some diseases, we have the autoantibodies appear in the blood of the patient 3 to 5 years before a person feels sick. And this was found in a study done to protect or to prevent rheumatoid arthritis. What are the types of autoimmune diseases which affect children? We have two major categories. The first category is organ-specific disorders, which is called also localized disorders. It affects one organ or a specific type of tissues. Example of this is Addison's disease, autoimmune hepatitis, Crohn's disease, ulcerative colitis, multiple sclerosis, which affect the brain and the spinal cord, causing degeneration of the myelin sheet of the neuronal cells. What is PANDAS? PANDAS is an autoimmune neuropsychiatric disease which affects kids in association with streptococcus infection. So it affects their CNS and psychological status. And these are the features, as you can see. Type 1 diabetes, Hashimoto's disease, and insulin autoimmune syndrome, which is a rare syndrome called Hirata disease, which appear as severe hypoglycemia secondary to high insulin because there is autoimmune reaction against self-present insulin. The non-organ specific disorders, which is including like juvenile dermatomyositis, scleroderma, Kawasaki disease, systemic juvenile idiopathic arthritis, SLE, the mystery inflammatory syndrome, which is a reaction to COVID-19 infection. So many environmental factors were proven or have high association with the autoimmune diseases. And there was one study done for rheumatoid arthritis, describe a positive association of rheumatoid arthritis with the following factors, including smoking, short fertile period in women, inverse relationship with length of breastfeeding. And what is the meaning of inverse relationship with length of breastfeeding? It means the longer the mother will breastfeed, she has higher protection from development of rheumatoid arthritis, even if there is positive family history. Presence also of history of atopic allergies, psychosocial stresses, private well water, history of self-reported thyroid conditions, use of insulin, and obesity. We will talk about these factors also now. So what is the relation of contaminated water? The drinking water, if it is contaminated, it can trigger autoimmune disease because water quality is very important. If it is contaminated with bacteria or heavy metals or any toxins, it can trigger autoimmunity. Obesity was also associated or increasing the risk of development of autoimmune diseases, and if there is autoimmune disease, it makes it more severe and difficult to treat. So unless you manage obesity, the autoimmune severity, disease severity, it will continue. Also, the autoimmune diseases were found to be associated with hormonal changes and swinging in the hormones. It was showing that there is bidirectional communication between the immune system and endocrine system. So what are these hormonal changes? The hormonal changes, example of that is hormonal replacement therapy, like estrogen replacement or thyroxine or insulin or whatever hormone we replace to increase the chance of autoimmune diseases. And this was found in SLE. Hormonal variability, like also using contraceptive pills. It was found in one study that it is increasing chance to have SLE. The strongest hormonal relation was found in Carolina lupus study, which was done in 2017. As we said, it was showing that increasing the breastfeeding duration will decrease the risk of developing SLE, but in contrast to that, the preeclampsia was increasing the risk of development of SLE. Psychosocial stressors also was found that it is increasing the chance to develop autoimmune diseases, especially rheumatoid arthritis. It was found in that women who got rheumatoid arthritis 5 years before diagnosis, they were also having some social problems related to whatever stresses they have, and for men, problems at work was preceding the onset of symptoms of rheumatoid arthritis. Also, type 1 diabetes was shown that it happened in patients who has disparate social environmental factors before they were affected. So the relation of immune dysregulation with the stress were documented because of the production or amplification of cytokine production secondary to stress. Even babies, they can have stress. And children, they were found that they have stress, which can be severe secondary to problems between parents and bad interaction between parents. And common causes of stress for children listed here, like having new siblings and moving to a different place, starting school, divorce of parents, family, illness or death, and the list is long. So unless we break the stress, we cannot treat autoimmune diseases well, and we have higher chance to have it. These are researches and studies done to stop the rheumatoid arthritis. And as we previously mentioned, that the patients 5 years before diagnosis, they can have this elevated blood test called CCP, which is cyclic citrullinated peptide antibodies in blood. And also another studies to stop the diabetes, type 1 diabetes, and third study to stop the lupus prevention study in Oklahoma Medical Research Foundation. So the balance between the regulation of the autoimmune disease, regulatory cells, and the pathogenic T effector cells will prevent the body from having autoimmune diseases. So if the effect of this pathogenic T effector cells and its presence is higher than regulatory cells, we have the autoimmune disease happen. These are one example of the pathogenic cells. We call it T helper 17 cells, which increase the secretion of interleukin 17. The presence of this will inhibit the T regulatory cells differentiation. So the patient will have the autoimmune disease. So what is the effect of infection on autoimmune diseases? Infections, it can lead to chronic progressive disease, it can induce relapse, and it can exacerbate ongoing disease. So it can be a triggering factor to occur, and it can be a factor to cause more exacerbation and severity of the disease and difficult to be controlled. Many infections were found that it is related to cause or increasing chance of having autoimmune diseases. And it is well known in pediatrics. We have an example like rheumatic fever, which can happen secondary to the presence of beta hemolytic streptococcus infection. Enteroviruses like Coxsackie B4 viruses and rotaviruses, which can cause the gastroenteritis for children, it can precipitate type 1 diabetes. Also herpes zoster and Epstein-Barr virus, it was found that it is increasing chance to have SLE. Vaccination against hepatitis B has been noted to predate the diagnosis of SLE in some instances. Urinary tract infections, it has a strong link exists between presence of Proteus mirabilis microbes and UTI in cases with rheumatoid arthritis. So subclinical infection or untreated infection of UTI can increase the chance of having autoimmune diseases. Rubella and mumps also were found that it is associated and increased the risk to have type 1 diabetes. Also, following vaccination, there was reports showing that autoimmune disorders can happen after vaccination, like example like idiopathic thrombocytopenia purpura, myopericarditis, and primary ovarian failure and systemic lupus erythematosus, especially in cases with positive family history of autoimmunity. Pneumonia it was associated with increased risk to develop rheumatoid arthritis in women, but not in men. Also, respiratory tract infection like mycoplasma pneumonia was showing that it can trigger the happening of Guillain-Barré syndrome. And also mycoplasma pneumonia, it was associated with emergence of various autoimmune disorders. And also increasing the chance of having the anti-double-stranded antibodies, autoantibodies, and anti-citrulline peptide autoantibodies. So increasing the chance of autoimmunity secondary to mycoplasma pneumonia infection. Also, it was increasing the chance to develop ankylosing spondylitis. So many autoimmune diseases were found that it is increased, having increasing chance post mycoplasma pneumonia. case report also of association between mycoplasma pneumonia and hemolytic anemia, increasing risk of rheumatoid arthritis. So, one reported new treatments for autoimmune diseases by Professor Garth Nicholson mentioned that treating the patients with infection with antibiotics, treatment using antibiotics was effective against such infections which cause or predispose to autoimmune diseases. So some antibiotics are effective in treating rheumatoid arthritis. So they mentioned that our recent results indicate that in addition to rheumatoid arthritis, other autoimmune diseases can be treated with antibiotics to suppress chronic bacterial infections, and also using antivirals to suppress chronic viral infections. Patients with such infections gain significant clinical benefits by undergoing therapy against chronic bacterial and viral infections. So treating infections, bacterial or viral infections effectively with antibiotics or antivirals is important to decrease the chance of development of autoimmune diseases. Also, it was proven that oral pathogens like Porphyromonas gingivalis, which is a gram-negative rod-shaped anaerobic pathogenic bacterium, which cause oral infection, it increased chance of autoimmune diseases. This is the Porphyromonas gingivalis gram-negative infection. So, poor dental health increased chance of cardiovascular disease and increasing the myocardial atherothrombosis. What else? The oral infections and gingivitis, it can predispose to systemic autoimmunity and multiple immune reactivities. So brushing and flossing teeth regularly can keep teeth and gum clean, and this decrease, it was found that it is key to avoid autoimmune diseases. هذا يذكرنا بحديث الرسول صلى الله عليه وسلم فيما يخص استخدام السواك بشكل متكرر لنظافة وطهارة الفم. This is very important to protect the immunity. Many studies proven this, and it was correlating the higher plaque index with the and marker which is a marker of poor oral hygiene. It indicated with the chance to develop autoimmune diseases. This was a study done for 30 years in Sweden. What else after the infection problem? Infection, as we said, we need to improve the immunity and decrease the chance of infection and keep good oral hygiene to prevent that factor, the environmental factor. What about protecting the gut microbiomes and prevention of dysbiosis, which is the imbalance between the gut microbiota, between tolerogenic and non-tolerogenic state. This dysbiosis or imbalance can happen secondary to using antibiotics or probiotics. This may influence the development of type 1 diabetes. This was found in a study. There is sufficient indirect evidence that gut and other microbial agents, for example, Mycobacterium avium, which is waterborne opportunistic bacteria, they trigger type 1 diabetes. So the gut is the gate for autoimmune diseases. If it is protected with normal and healthy microbiomes, this improves the immunity and protect from autoimmune diseases. What affect this microbiomes? The most important factor is the dietary influences on that microbiomes. It will change its composition and metabolite production if it is affected, if this microbiome is affected in composition and metabolite production, the imbalance will happen and the immunity will be weakened and increased chance for autoimmune diseases. Diet shapes gut bacterial ecology and diversity, and the composition of the gut microbiota relates to human disease. So the healthy microbiota in number and diversity. Nobody knows what is it exactly, 100%. But it was found that low bacterial richness and low bacterial diversity was associated with inflammatory bowel diseases, Crohn's disease and ulcerative colitis. Metabolites produced by bacteria in the gut are, which is very important, metabolite is this short chain fatty acids, which is an essential amino acids occurring secondary to the digestion of dietary fibers. And this is this metabolites, such as this short chain fatty acids and long chain fatty acids and tryptophan and metabolites, play a major role in prevention of inflammatory diseases. This is the mechanism for the induction of autoimmunity and neuroautoimmunity by environmental triggers. If we go back to early infancy and neonatal part, what is the protective factor? Is the right nutrition for the neonate and for the infant, which is exclusive breastfeeding. It was found that this is protective from many autoimmune diseases in the future, and mainly type 1 diabetes and also other parts of the autoimmune diseases. There was studies done to check the effect of hydrolyzed compared with non-hydrolyzed cow's milk-based infant formula in the presence of autoimmunity, but and protection from genetic protection from type 1 diabetes, but it was found that it is not protective, the hydrolyzed cow milk formula. This is example, as we said, the infant feeding formula and the ready-made stored food for infants. All these substances is bad start, and it has a strong implication to predispose to autoimmune diseases. Western lifestyle with the Western food increasing the chance of autoimmune diseases such as diabetes and multiple sclerosis. So what is the problem with the Western diet? It has many problems, and the presence of saturated fat or rich presence of high level of saturated fat and salt is related to many pathologies, and the studies link that to increasing the percentage of multiple sclerosis in the Western countries. Why the diet became unsafe these days? Because there is a new food component sources, like new breeds of food plants and food animals, genetic modification of the food, chemical ingredients, flavors, preservatives. This is an example of Western diet. Why Western diet keeps making us sick? Because it increases the glycemic load, fatty acid composition, macronutrient composition, micronutrient density, and acid-base balance, sodium-potassium ratio, and fiber content. Besides the excess burden of additional calories, emerging research is also pointing to the detrimental effect of the Western diet on our gut bacteria, the microbiomes, and immune system. So it is not only the issue of overweight and obesity and diabetes. It triggers the emergence of many diseases. We hear a lot about this gluten sensitivity and the disadvantage of gluten ingestion. This was proven that it is associated with celiac disease, but also other diseases were related to this gluten sensitivity, which showed extra-intestinal autoimmune disorders involved the thyroid gland, joints, heart, skin, pancreas, bone, liver, reproductive organs, and nervous system. Why gluten can be a risk, and what is the mechanism? They found that there is molecular mimicry between the gliadin or transglutaminase and various tissue antigens, including nervous system proteins. So this can predispose to autoimmune disease or disorders involving many organs. So is gluten-free diet a healthy choice? For non-celiac gluten sensitivity, so we can not say that it is indicated and very healthy, because it can increase, it has many disadvantages, generally entails the increased food costs, decrease in fiber consumption, and potential decrease in mineral and vitamin consumption, including calcium, magnesium, zinc, and vitamin B12, folate, vitamin D, and potentially increase exposure to dietary hydrogenated and saturated fatty acids and arsenic. So it is not 100% safe to use only gluten-free diet in absence of having celiac disease. Also, milk was blamed to predispose to autoimmune diseases because it has many proteins and over 150 amino acids in the milk. Some of the amino acids mimic the collagen, so it might induce rheumatoid arthritis, and some mimic the neural cells, So it might predispose or induce multiple sclerosis or other neuroimmune disorders. Dairy products was shown in Japanese study to increase the chance of SLE. In contrast to that, the human milk oligosaccharides was shown to protect from autoimmune diseases. Vitamin D deficiency was increasing the chance of many autoimmune diseases. It was found that it was found more to happen in cases with SLE and rheumatoid arthritis. And third is the diabetes, type 1 diabetes. So many cases of autoimmune diseases, you find that they have vitamin D deficiency. Sodium chloride is a major content in the Western diet. It has high sodium chloride content. And this was found that it is associated with high blood pressure, increasing chance of cardiovascular diseases and stroke. And also it impairs the macrophage function. So in many studies, they found that it is correlating with multiple sclerosis and psoriasis and other autoimmune disorders. So what is the choice? What is the best choice for diet? The studies give a scientific credibility to the the Mediterranean diet. It has higher prevention for cardiovascular diseases, bronchial asthma, and autoimmune diseases proven by studies. What is the Mediterranean diet? Mediterranean diet is mainly containing olive oil, greens, fresh fruits, no corn, raw or lightly cooked vegetables, unprocessed food, natural flavors, fish, some dairy products or goat milk, versus the industrialized or Western food, which is having the other type of oils and trans fats, a lot of rice and canned fruits, corn, deep frying and charred, broiled things, highly processed food, artificial flavors, colors, sweetener, red meat, high dairy or cow milk. So studies given the credibility for the Mediterranean diet to be the best and less chance to have diseases. So the most optimal dietary strategies for body composition is to eat food not too much, mostly plants. ذكرنا بحديث الرسول صلى الله عليه وسلم ثلث لطعامه ثلث لشرابه ثلث لنفسه. Some of the most simple changes you could make is prioritizing protein, eat more plants, stay hydrated with non-caloric beverages, focus on fibers, and slash sugars. So the healthy foodstuffs adversely affect the production of bacterial metabolites. So these metabolites and those derived directly from food derive beneficial downstream effect on immune pathways. So the healthy food stuff is very important to keep normal immune pathways. Toxins, for example, we have the nail polish. This type of cosmetics, it was found to be associated with primary biliary cirrhosis in some cases because of the presence of halogenated compounds which bind to the mitochondrial proteins and cause autoantibodies against the mitochondria. And also the exposure to crystalline silica, occupational exposure to crystalline silica, increase the chance to develop SLE. Also one of the major toxins which increase the chance of autoimmune diseases was found to be cigarettes. Hair treatment with prolonged use also increase the risk to develop SLE. These are some also other environmental toxins like solvents, ultraviolet light, air pollution, periodontitis we mentioned before with this oral infection, and obesity. Alcohol also was found to increase chance to have rheumatoid arthritis. Autoantibodies and drugs. Some drugs, they were blamed to increase the chance of having autoimmune diseases, and part of it was found to be tumor necrosis factor inhibitors, gamma interferons, and other biologic medicines. And the drug-induced lupus was tend to be less severe than SLE, and with symptoms usually resolving after discontinuation of the offending agents. But some drugs, even the destructive effect of the disease will be very severe and irreversible. So what is the take-home message? We need to adapt a healthy lifestyle.
حسسيني انحرج يعني عبد العزيز اخوي اختي.
Can you silent please? Can you silent your mic, Abdul Aziz? Silent your mic.
So the adaptation of healthy lifestyle, including perfect dental hygiene, avoid exposure to environmental toxins, healthy food, and enrich your microbiomes. Treat infections effectively. If patient has a positive family history of, if a person has a positive family history of autoimmunity, he should have regular checkup and looking for autoantibodies. Thank you very much. Any question?